The Ministry of Health is questioning the sincerity of Kenyans, still doubting the existence of the killer coronavirus. Health Cabinet Secretary Mutahi Kagwe, who was in Kakamega County, said it was disturbing that some Kenyans have adamantly refused to comprehend the devastating impact the COVID-19 disease is having in the country. Kagwe cited a man who refused to come to terms with his COVID-19 positive status and ended up spreading the virus to his relatives, one of whom has succumbed to the disease, as the country recorded 699 new cases in the last 24 hours, with 5 deaths recorded. The Ministry of Health is warning Kenyans still in denial that the COVID-19 disease has actually established its roots in the country, and the don't care behavior will only act as a catalyst for further spread of the deadly virus. Health Cabinet Secretary Mutahi Kagwe, who spoke during his tour of Kakamega County to assess the county's preparedness, regretted that the action by the younger population was costing lives of the vulnerable groups.
I've just received news from one of our counties about a situation that perfectly illustrates what we have been talking about. A son who was tested and confirmed as positive for coronavirus refused to accept the diagnosis because, according to him, the virus is a myth and it does not exist. Based on this, he refused to self-isolate, which led to the infection of his sister and parents. Unlike him, they are old, they are elderly, and as is a usual case, had underlying conditions, so they were impacted more. As we speak, this family, whose first positive case is still alive, has lost an elderly family member, the head of the household, just 2 weeks after it lost and buried his mother.
The health CS sounded an alarm that it may be difficult to stop the fast-spreading virus if Kenyans do not change their attitudes and embrace the new normal.
I can only implore you to accept that COVID-19 is a reality. But when handled properly, through all the measures you are only too familiar with at this point, it is a condition that we can control. Kenyans don't have to die. We can do this thing. We can manage ourselves, we can save lives, and we can save ourselves in the process. Wale watu ambao wanahitaji kupatiwa mask ni wale watu ambao hawana kazi. Hana kazi, kwa hivyo hawezi kujinunulia mask. Lakini ukiwa una homa na unaenda kazi, si unaenda unanunua handkerchief. Ukienda kazi, unauliza serikali ipatie mtu handkerchief.
Kagwe spoke as the country recorded 699 new coronavirus cases from 7,171 samples in the last 24 hours, and the country's virus caseload now stands at 25,837.
Sadly, we have also lost some 5 patients today who have succumbed to the virus, and therefore, as we speak, we have got 418 Kenyans who have perished.
And because we are not a COVID testing center, and CS, I think this is an issue that I have engaged you, that we need as a region, we have all to go to Kisumu. So our testing capacity is very low. We have managed to test 629 samples, out of which 596 tested negative and 33 have tested positive.
However, 781 people were discharged over the same period, raising the total number of recoveries to 11,899. 125 of them were discharged from various hospitals, while 656 were under the home-based care program. Purity Museo, Channel 1 News.